Hi, everyone. Thank you for joining. For those who have joined, we're just going to give it another couple minutes for folks to continue joining before we get started. All right. Good afternoon, good morning, depending on where you're joining from. Thank you all for joining the last of our Innovation Hub Learning Community webinars for the year. My name is Laura Powis. I use she, her pronouns, and I am the Senior Program Manager for Evidence-Based Policy and Practice here at AmChip. And today we're going to be talking about cultivating community solutions, building capacity for community-rooted evidence in Title V and larger MCH practice. So a little bit of context just about this webinar series. This webinar series is a part of the Innovation Hub Learning Community, which is our technical assistance opportunity linked to our maternal child health innovations database. As a part of that learning community, we offer technical assistance and one-on-one coaching and support, as well as peer sharing opportunities for folks in our database. But we also have this webinar series that focuses on the skills and strategies you can to improve your organizational processes, expand the scope and impact of your practice, and plan for program sustainability. And this is open to everyone, not just Innovation Hub practices. So we have a lot to cover today, but to dive right on in with some objectives that are going to guide our work together. The first objective is for folks to be able to define the core components of and guiding principles for using community-rooted evidence. To reflect on the degree in which participants are currently using community-rooted evidence to inform your work. And then also to explore recommendations for how to better uplift community-rooted evidence in your own context and organizations. So kind of a bit of lay of the land. We're going to do a little bit of level setting for about 10 minutes. And then the bulk of our time together today is going to be talking about the core components of community-rooted evidence. We'll then look through a case study example of really like what this looks like in action, and then end with questions as well as recommendations for uplifting community-rooted evidence. So, unpacking evidence in maternal and child health. So where should we start? With a little bit of background on the issue. So traditional evidence in maternal child health, that being research evidence from randomized control trials or other larger scale research studies, can often overlook the lived experiences of Black, Indigenous, and people of color of BIPOC communities. This can be because of the type of folks who are participating in the research might not reflect these communities that programs are intended to be serving. Community-rooted evidence, which we are calling CRE, which if you've heard of the term community-defined evidence, this is a slightly updated term to encompass a little bit more of the orientation of where this evidence lies in communities. It seeks to uplift these voices, ensuring that programs are responsive to community needs. AmChip convened a work group and is conducting research on MCH professionals and community-based organizations to incorporate community-rooted evidence into funding and program decisions. This is where that updated term came from. And the work group is comprised of community-based organizations as well as Title V professionals. And we have compensated folks as a part of this work so that we are making sure that their insights and brilliance that they're sharing with us are being used equitably. But so today, our focus of our conversation is really going to be on community-rooted evidence, but I wanted to just quickly do a refresher on the different types of evidence that exist as a way to help kind of guide the conversation. So there's that research evidence, which is thought of as what we often think about as like kind of the traditional evidence. Those are studies, those are longitudinal reports. There's experiential evidence, which can be thought about the cumulative lived experience of either people most impacted by the program or policy, people who are responsible for implementing the program or policy, and then there's contextual evidence. And so that can often speak to the fit and feasibility of a given policy or practice, as well as a kind of community perspectives and beliefs around the impact of that work. And so the really important thing to stress here is that taken all together, we're looking at a balance of these different types of evidence when we are making evidence-based decision-making in the maternal and child health field. So just a teeny bit more about each of these types of evidence before we really deep dive into community-rooted evidence. So research evidence can be thought about that information that comes from scientific evaluation that helps determine if a program or strategy is achieving its intended outcomes. So that can be systemic reviews, peer-reviewed journals. Contextual evidence is that information about whether a policy or program is useful, feasible to implement, and accepted by a particular community. So this is often where community-rooted evidence lies. And so this can be evidence, information collected from focus groups, practices and policies in the AmChip's Innovation Hub. And then we have experiential evidence. So experiential evidence is really the collective experience and expertise of those who have participated in or lived in a particular setting and includes the knowledge of subject matter experts. And so some sources of experiential evidence could be national guidelines or standards, as well as the Title V Block Grant Needs Assessment. So just a little bit of definitions before we get started. So thinking about the term community, we've said this a lot in our term community-rooted evidence. In our work in general, we are talking a lot about community all the time, but what do we really mean when we say that? So AmChip's community-rooted evidence work group came up with the following definition for community, which is a group of people with diverse characteristics linked by shared experiences, identities, perspectives, actions, and or social, cultural, or geographic ties. So this is quite a broad definition, and I think it's important to keep this definition broad and really highlight the fact that communities are responsible for defining for themselves if they are a part of a given community or not, and that when engaging in policies and practices, it's really important to make sure that we are working with communities to working with the individuals we're hoping to impact to help define what community means to them and who's a part of their community. So now that we've level set on that a little bit, let's talk about community-rooted evidence. So again, this definition was developed by AmChip's community-rooted evidence working group, modifying and building off of the past definition for community-defined evidence. So community-rooted evidence is the knowledge, experiences, and stories from communities that show how well a program or policy works for them. This approach values often overlooked expertise by focusing on success defined by the communities themselves based on their unique needs and solutions. So community-rooted evidence is important because it helps to build trust and center the expertise of those within the community in the evidence process. It helps to ensure that programs are aligned with the specific needs, values, and context of participants. It ensures that programs and processes are grounded in equitable practices. And it supports the sustainability of the programs that are created. So now, without further ado, we're going to talk a little bit more about what makes community-rooted evidence. What is community-rooted evidence? So when we're trying to define community-rooted evidence, we're really thinking about what are the core components. So a point of confusion that often occurs when folks are talking about community-defined evidence is folks are thinking so much about the what is community-defined evidence, Something that's really come out of our work group is highlighting how much it's also about the how, about how evidence that informs practices and policies is collected, is utilized, and is disseminated. And that's why in defining community-rooted evidence, we've decided to focus more on core components of community-rooted evidence. So core components are really those essential elements that make up a given strategy or approach. So I like to think about an example of if you are baking chocolate chip cookies, right? What are the core components of baking chocolate chip cookies? You're going to need to have some sort of an oven of sorts, some sort of heat source that's going to allow you to cook that. You're going to need some surface to cook them on. And then you're also going to need your ingredients, right? So you're going to need some type of flour, some type of chocolate. Notably, there are different ways that you could modify those core components of our chocolate chip cookies, and it still could be a chocolate chip cookie. So let's say we turned our flour to be gluten-free. That would be a modification off of a core component, but it's still the same product in the end. So when we're thinking about core components of community-rooted evidence, we're thinking similarly. So some of the core components for community-rooted evidence include community involvement, community-driven metrics, culturally responsive evaluations, consensus over time, taking an assets-based approach, the community defining success, community having stewardship over evidence, and the use of non-research-based methods. And if you're like, Laura, that was far too fast, don't worry, we are about to deep dive each one of these components. But I just wanted to present them all here with a little context around what are core components before we dive in. So community involvement. The communities most impacted by an initiative should be included in all aspects of evidence generation. So this helps to ensure authenticity and relevance. The community holds valuable lived experiences that are essential for generating relevant evidence. Their involvement ensures that the data collected genuinely reflects their needs, challenges, and preferences. There's also cultural sensitivity and trust. So engaging the community helps build trust and ensures cultural sensitivity. When people see that their voices are included in shaping the research, shaping the evidence, they are more likely to trust those findings and trust the initiative's intentions. So including folks in aspects of evidence generation can be really important for building that trust between whoever is sharing out that evidence and the folks most impacted, as well as the community-based orgs that are often a part of creating evidence. It can also lead to improved quality of data. So communities can provide insights into nuances that outsiders might miss, improving the accuracy and quality of the data. This ensures that the evidence is robust and representative. This is a really important point to highlight because I think sometimes in these conversations, folks can hear us talk about community-rooted evidence and say, so are you saying that research evidence does not matter? That's not what we're saying. We're really saying that when making evidence-based decisions in maternal and child health, we need to be looking at a balance of evidence, and one of the pieces missing right now is community-rooted evidence. So we really need to lift that up and it helps to ensure it helps to provide nuance and context reflective of the nuance and context of communities. Another piece of community involvement is ownership and empowerment. So including the community promotes a sense of ownership over the initiative, can empower them to actively shape the outcomes that will impact their lives, which is a step towards more sustainable and equitable solutions. We have accountability. So accountability, engaging the community in evidence generation creates a system of accountability for the initiative's partners. It ensures that the results are grounded in real-world impacts and reflect the community's priorities rather than just the perspectives of external entities. And all of this together helps to lead to more effective implementation. So when a community participates in generating evidence, they are more likely to support and engage with the initiative during its implementation, increasing the likelihood of success. By including the impacted community throughout the evidence generation process, design, data collection, analysis, and dissemination, the initiative becomes more inclusive, effective, and responsive to the people it aims to serve. So that was our first of our 8 core components. So next up is the idea of community-driven metrics. And really this boils down to the initiative process and metrics are all driven by the preferences, expertise, and knowledge of those most impacted by the issue being addressed. Um, so this includes, oops. So this includes metrics that are rooted in real world impact. Uh, Having community-driven metrics ensures that the metrics that we're using for success are actually going to be representing what success means to the community. To do that, you really need co-creation and collaboration in defining what success looks like, and this can help to lead to sustainability and long-term impacts of the work overall. The next core component is culturally responsive evaluations. So the evaluation process of an initiative and indicators of success should be culturally responsive and community driven. So some things to consider with this are understanding context. So culturally responsive evaluation involves gaining a deep understanding of the community's social, cultural, historical, and economic contexts, which can help evaluators avoid imposing external standards that may not align with the community's values or experiences. A respect for cultural practices. So the evaluation process should respect and incorporate the community's cultural norms and practices. And this may show up in the types of data collection methods that you choose to use. So those methods should be adjusted to respect cultural norms around communication, privacy, or decision making. So it's really important when you're conducting evaluation to make sure that you are conducting and planning for your evaluation with feedback from community. As you see on the slide around feedback loops, these kind of continuous feedback loops with community can help to provide ongoing input so that adjustments can be made in real time for how the community, so that the community can have a say in how success is assessed and tailored. And then it's really, really important to use culturally relevant tools. So that involves both the type of evaluation tool as well as the language of the tool itself. So develop evaluation tools that reflect the community's language and forms of expression. Surveys, interviews, focus groups may need to be adapted to ensure that they are relatable, understandable, and appropriate for a given community. All right, we have 3 down, 5 to go. So the next step is consensus over time. So community consensus, establishing community consensus of the success of an initiative is an iterative, dynamic process that requires ongoing engagement, transparent communication, and adaptability. Success is co-defined with the community and celebrated through incremental achievements and is continually reassessed to reflect the evolving needs of the community. And by fostering this kind of collective reflection, the initiative becomes more resilient and sustainable in the long term. And so to highlight this core concept, I wanted to really talk about an example that we have in our AmChip Innovation Hub, which is our Medical Home Community Team Project. So the Medical Home Community Team Project is based out of Philadelphia, and it provides intensive, homegrown, as they say, and high quality home visiting services to especially underserved and marginalized Brown and Black families in Philadelphia, and it centers their work on social determinants of health. And the team works collectively with referred children's pediatric medical homes and an equal partnership with all the families who are a part of the program to address the impacts of their health inequities. And so this is a program that's been around for a really long time, and it has a lot of established buy-in in the community. That's demonstrated by the sheer number of kids who've gone through the program, as well as the fact that a lot of the families served by the program have actually gone back to work there. We at AmChip learned about this program because they came to us with a challenge where their funding was running out and they were exploring new funding opportunities, but they weren't deemed evidence-based because they hadn't had a formal evaluation done yet. And so we're struggling to be able to receive some federal and state funding because of that. So we at AmChip were working with them to get them into our innovation hub so that we could try to help address that kind of, I guess, gap in the evidence. And in our process, we really saw there were so many great examples of community-rooted evidence that this team had based on the stories of the participants who've gone through, based on the folks who work there. And importantly, that understanding of success was really consistent and established over time. And so some folks ask us, what does over time mean? How long is that? The hard answer is that it is subjective. It's based on how long the program has run. So something that has had one single pilot and shows some promising answers, that might fall into that kind of experiential evidence category or some of that contextual evidence, but we wouldn't really deem that necessarily community rooted evidence yet, as there isn't that time piece. That was part of our desire to change away from the community defined to community rooted language. Rooted really felt like it captured a little bit more of that, the time piece in thinking about evidence. So our next core component is taking an assets-based approach. So this is really highlights that the process of gathering and disseminating community-rooted evidence should emphasize community assets and strengths. So it should build upon existing strengths. So thinking about what has already worked well at that community level, what could be leveraged. A piece of that is really leveraging local expertise. So recognizing and integrating the expertise of community members, whether in whatever domain of public health it may be. And this local knowledge should inform the process of using community-rooted evidence and data. And it's really important to be identifying and elevating successes. So when gathering evidence, focusing on identifying what are those existing successes within the community. And these successful models can provide inspiration and the background, the basis for future models. So really the point here is just to think about and uplift community strengths as you're engaging in this work. So another key piece, which I've mentioned a couple of times now, is this idea that communities define success. So there should be active, respectful, and ongoing collaboration with the community in defining what success looks like for a given initiative. So this happens through a number of different ways, but one of those ways could be collaborative data analysis, which we'll talk about a little bit more in detail in the next core component. A respect for cultural knowledge. This is something that we have found to be really important. What an outside researcher or an outside practitioner might think success looks like for a community might be very different from what the community is looking for themselves. And as such, it's really important to have that kind of co-definition process that's rooted in respectful relationships and respect of cultural knowledge in developing what success looks like. Our example later, I hope, was going to help elucidate a lot of the nuances of these ideas. But really, it's just important to make sure that cultural values are reflected in those definitions of success. So that really is that collaborative definition of evidence. So when you're working with communities to define what constitutes valid evidence, different communities may value different forms of evidence, such as lived experience, oral history, or traditional knowledge, alongside that more conventional quantitative data. Again, we're really trying to emphasize the alongside, the way that community-rooted evidence can help provide the context around this quantitative data that is also important. And it's also really important to have these context-specific indicators. So as we just mentioned with the kind of community-defined metrics, it's really important to allow the community to co-create the indicators of success and the kinds of data that will be collected. These indicators should be reflective of the community's values, culture, and goals, and ensure that the evidence generated is meaningful and relevant. So the next core component is really the stewardship of evidence piece. So the community should be the primary steward of gathered evidence and should have ownership over how that evidence is used and interpreted. So when the community is positioned as the primary steward and owner of the evidence, it shifts the power from the people, it shifts the power to the people who are most affected by the issues being studied. This approach can foster self-determination, cultural preservation, and the ability to use data in ways that reflect and advance the community's own goals and values. By embedding ownership in every step of data use, the community gains agency over its own narrative and the future, ensuring that the evidence serves their best interests and promotes long-term empowerment. So some intellectual property rights considerations that I think are really important to name. So we need to consider intellectual property for the evidence that's gathered, recognizing that often the community-rooted approaches to work, especially those coming from community-based organizations, that's really their intellectual property. That often is their livelihood, the way that their programs work and having that proprietary information. So really thinking about, especially if you're coming from a state public health agency, how can you protect that and respect that work in a way that is not exploitative? And so ways that this can look is establishing guidelines on how the community's data can be published, ensuring that they receive proper credit and control over any uses of their data or any replications of their approaches. Another piece of this is culturally relevant dissemination. So you're going to want to disseminate the findings of the community-rooted evidence process in ways that are accessible and meaningful to the community. And this could involve visual presentations, community gatherings, storytelling events, or local media. The goal is really to share evidence in forms that resonate with community cultural practices and communication styles. As I mentioned before a little bit with the last core component, there's this really important piece around collaborative data analysis. So once data is gathered, once evidence is gathered, be it through stories, focus groups, quantitative data surveys, you're going to want to make sure that the community is involved in interpreting those findings. So this could look like holding community forums, workshops, or meetings where data is collected and reviewed, and conclusions are drawn based on the community's perspectives. This ensures that the community's strengths are recognized in the analysis and not just external interpretations. So again, participatory reflection can be a really great way to do this. So you might want to organize workshops, reflection sessions, or community forums where the data is reviewed collectively, because this allows the community to help identify patterns, trends, and implications that align with their lived experiences and realities. And another really important piece I want to highlight is this idea of mutually beneficial data uses. So again, a lot of these core components are really rooted on partnership. And so we're wanting to think about using this data in a way that both benefits the community and the external partners. So this could be your funders, or this could be your organization. So you're going to really want to ensure that the evidence serves community priorities while also informing external decision makers, funders, policymakers in ways that are respectful and responsive. All right, and then our last core component to really talk through here is evidence gathering centers stories. So community-rooted evidence is typically determined through non-research-based methods that prioritize qualitative evidence and storytelling. So oftentimes community-rooted evidence, it really just places such a high value on that cultural knowledge and of that narrative storytelling piece. So thinking about that kind of narrative storytelling piece, many cultures, many communities might place a high value on oral traditions and storytelling as a way to convey knowledge and expertise and experience. And these can be really powerful tools to culturally responsive approaches to evidence, allowing participants to share their experiences in ways that are meaningful to them. So just some ways that you might gather this evidence also includes like community workshops and gatherings, which could be informal peer learning sessions or workshops where community members share their knowledge and skills with one another on a platform for generating evidence. And these can also be, these exchanges can help reveal best practices and community-based solutions to local issues. And so now that you've listened to me talk about these core components, I wanted to give folks a chance to share what we're thinking, what you are thinking around which of these core components do you feel most comfortable with. So which of these kind of approaches of engaging evidence do you feel currently the most comfortable with? So what I'm going to ask for you to do is select that annotate feature. And if you're struggling to annotate, you can also chat into the chat. But if you click on those kind of three dots you should see near the upper like toolbar for Zoom, and click on that annotate feature, you'll see that there is an option to add stickers to the slide. So I'm going to ask if you click on that check mark, that stamp check mark, that's when you're able to access those stickers, and then you can kind of select which of the different metrics you might feel most comfortable with. So I'll give folks a couple minutes here to sort of figure out and think through which of these metrics you might feel the most comfortable with and add a sticker to those boxes. Oh, okay. Darn, we tried this earlier. I guess we must not have it set up. Thank you, Becky, for letting us know that. Feel free if you want to just chat in then into the chat box. What feels the most, which of the core components you feel the most comfortable with? And sorry about that. I thought we had that enabled. And that's okay if folks are not sure right now. I'm seeing community involvement. Someone kind of drew on an option there, like a star there indicating. I'm seeing folks in the chat saying community involvement, community-driven metrics, and culturally responsive evaluation. So that is so awesome to hear that you already are feeling pretty confident with those different types of these core components. Which leads me to my next question, which of these do you feel the least confident with? Which of these might be newer core components or metrics that you aren't feeling quite as comfortable with and might want more support in developing skills around? I'm seeing an asset-based approach. Um, Thank you for sharing that. Anyone else have any? Because these type of things definitely can help inform some of the resources that we are going to be able to keep promoting as a part of the Innovation Hub learning community. Totally cool too if you're going to continue to think on that. As you're reflecting on that, also want to allow some space to reflect on these can be more internal reflections or reflections you might want to take back to your team, but thinking about to what degree does community-rooted evidence currently inform your work? In what ways does community-rooted evidence inform your decision making? And what capacity building needs do you feel that you have that you need in order to better support community-rooted evidence? So just some things to consider in thinking about how the core components that we talked about so far today relate to your own work. And now I'm really excited. We are going to kind of deep dive a case study example of what community-rooted evidence looks like in action. I know in talking about all these core components, it can feel a little bit theoretical, a little bit heady. So we are gonna really ground in a very practical, applied example of what this looks like in action. So Noelle just chatted in, there's a really great article that kind of goes into depth about a lot of what we're going to talk about and share today. But we're going to be talking about the Bienvenido program, which is operated by the Northeastern Center in Indiana. And it's a mental health promotion program for Latinos that addresses issues that come from an adjustment to life in another country. And so the like kind of logistics of what this program is it offers 9 1-hour group sessions with local residents who are trained as facilitators talking about mental health. So just some context about the city of Ligonier. So recreational vehicle manufacturing jobs back in the 90s, had there be a really large uptake of a really large influx of Latinx residents into this northeastern Indiana. So, Ligonier, which was a small rural community, saw its Latinx population grow by 522% over that 13-year span from 1990 to 2003. Oh, and I'm seeing that there is an attendee with their hand up in the chat. If the if you're able to come off mute, I'm not sure we have that enabled, but if you want to chat in your question, Teresa, I'm super happy to answer it. But while they're doing that, I'll sort of keep talking. But basically, just really wanted to, yeah, really highlight that this was a town that was a very small rural community, and it did not have the bandwidth or capacity to really adequately support the mental health needs of all of the new Latinx residents.
Laura, do you just want to pause for a second? I just allowed the function. I didn't know if Teresa still wanted to ask their question.
No, sorry, that was an accident.
Okay,
Okay. And then I see, oh no, okay, never mind. Go ahead, Laura.
thank you. Um, so to address this need, when the staff at the Northeastern Center established a collaborative needs assessment process as a first step in program development. And that really revealed that only 6% of the Latinx population who were surveyed had ever visited a mental health center, and that depression, anxiety, and substance use were prevalent. Um, so, staff and members of the Latinx community worked together to formulate questions to assess local mental health concerns and met several times to train different pastors, business owners, teachers, recreational league managers as co-creators in this project. And so, what they really did is they went into the community to those kind of key places where folks gathered to help incorporate and have their needs assessment process be influenced by those individuals. And the responses from this assessment directly shaped the Bienvenido program, um, which was super exciting to see. And the responses really emphasize the importance of three culturally relevant elements to the program. And that came out of those responses, and that was collectivism, the cultivation of a social support network, and then community integration. And so, by establishing these elements as foundational, the Bienvenido program incorporated a healing framework that encouraged participants to acknowledge possible trauma and distress resulting from immigration and stigmatized social status, identify positive coping strategies, learn about mental health and navigating available services when needed, and build social support networks and increase participation in social and political life. Participants who were surveyed about kind of the impact of the program and success said that by listening to and sharing their stories about mental health concerns, they learned effective strategies for coping with stressors and learning to access mental health services. Participants also said that the program increased their confidence about participating in community meetings, interacting with local elected officials, and speaking to health professionals about their health and potential treatments. So based on sort of these huge positive responses, there has been a lot of scaling up efforts that have happened kind of because this initial evidence of the success of this program in Ligonier. And so based on this positive response, this led to actually the program developers working with local teachers, parents, and immigrant Latinx high school students to adapt the program to adolescents in what was called the Bienvenido program for adolescents, very original name. And they added topics on family school engagement and a cultural and a stress that is experienced by Latinx youth and immigrant families. So this program for adolescents was established in 2009 and incorporated discussions between youth and their parents to encourage bonding between participants and caregivers over mutual interests, shared experiences, heritage, and family success. So really leaning into that kind of trusted adult to help with that youth mental health. So what's really exciting too to hear is that the positive response from the Bienvenido participants also led to requests from local community organizations all throughout Indiana for formal trainings on the to be a part of the formal Bienvenido facilitator training program so that they could replicate this approach within their own communities. These efforts were further supported by a partnership with the Indiana Minority Health Coalition to train staff and Bienvenido facilitators in 9 partner coalitions all across Indiana. And then in addition to that, they had the state's Division of Mental Health and Addiction approve funding to train 7 mental health centers across Indiana in the Bienvenido curriculum. So we kind of had those like local community level scale ups. We had the state level scale up. And then we actually had more of a national scale up where the Mennonite Church of the USA asked to help with training church leaders across the country in the Bienvenido curriculum. So that is a huge amount of scale up that happened. But it's really interesting to note that even though there has been this expansion of the Bienvenido in Indiana, and then 13 other states have since replicated it, and there's also this sort of national interest from these different national organizations. The formal evaluation findings for this program are limited. So this is really an example of an opportunity both where community-rooted evidence, sort of those success stories of those initial participants, and then the success of scale-up projects and the success of this kind of trust, right, in the community experience that this program was meeting their needs, allowed for the scale up, which then actually kind of built enough momentum around this that the Bienvenido project was selected for a SAMHSA evaluation consultant program that really helped them to articulate what their logic model was, what key metrics for success were going to be, and they did that in partnership with the program. And this led to a subsequent partnership with the National Network to Eliminate Disparities in Behavioral Health to train mental health professionals and leaders in 20 community-based organizations nationwide. So this example, I really wanted to walk us through kind of the whole timeline and process for this example, because I think, again, when we talk about community-rooted evidence, people often really want to focus on the what, like what is community-rooted evidence, but it's just as much about the how. And I think this example of the Bienvenido program really helps to highlight the how, helps to show how soliciting those community stories, especially at that beginning stage, right? Really engaging community in the need identification process, how that helped lead to a program that was really uniquely tailored to meet the needs of a specific population, which helped to ensure those positive results that then when shared, that kind of the success of this program over time helped to show the merit of its replication, which then eventually allowed it to now be at a place where it is, where it's now getting that formal evaluation. But had scale up not been able to happen unless it had that formal evaluation to start, the Bienvenido program wouldn't have been able to grow in the way that it has. It wouldn't have been able to form these partnerships. So this example really highlights the importance, especially when we're thinking about innovative work and work deeply tailored to individual communities. Community-rooted evidence can allow for a way to create these really practice-based evidence and like evidence-informed programs that might not have these formal evaluations yet that are kind of still the gold standard in the field. So now thinking about all those core components, thinking about that example, you might be wondering, well, how do I use this? What does this look like in the context of my own work? So the AMCHIP team, funded by Merck for Mothers, has a lot of really exciting resources coming out that are going to deep dive in a lot more detail, recommendations for uplifting and incorporating community-rooted evidence, both if you're a Title V person, if you're a community-based person, if you're in another agency, if you're a federal funder. But for right now, we're just kind of distilled it down to 5 key recommendations that you can apply to try to help support community-rooted evidence through your own work. So the first is flexibility and responsiveness. So when processes are driven by those most impacted, there's room for adaptation based on evolving needs and feedback from the community. This ensures that the initiative remains responsive and dynamic rather than rigid or prescriptive. So a part of our work, a part of the way that we helped understand these core components, AMCHIP has been working on a qualitative research study where we have interviewed community-based organizations and Title V participants, like 15 of each, around the ways in which community-rooted evidence currently informs their work, opportunities for us to better support that, opportunities for better partnership between Title V and community-based orgs. And this need for flexibility was something that was really highlighted. The need for both flexibility in reporting as well as flexibility in program sort of design and implementation to meet community needs. The key of community-rooted evidence is this evidence also needs to be deeply rooted in addressing community needs, and those needs change. Another really important thing is sharing power. So ensuring that power dynamics between evaluators or program staff and the community are balanced. Community should have decision-making power over how the evaluation and work at large is conducted, what is being measured, what is success, and how those results are being used. The next is holistic measures. So community-driven indicators often go beyond those quantitative measures. Qualitative metrics such as community well-being or sense of belonging, cultural preservation, and empowerment may be more reflective of success in certain contexts than maybe other metrics might be. So for example, let's take like a birth center. Let's say a funder is asking for how does that birth center's work impact C-section rates? Whereas that birth center might be more interested in what was the experience of the birthing person? Did they feel empowered? Did they feel like their needs were being met? Did they feel like their culture was being respected? These metrics may require alternative methods of data collection, such as interviews, narratives, or visual data, to really make sure that metrics are capturing how communities define success. And again, it's not saying that funders or state agencies can't come in and say, we would like you to, this is what we're hoping for success to look like. It's really important that kind of collaborative relationship and co-definition of success with community. And that also gets back to that power sharing and that flexibility. Our next recommendation is really community-led decision-making. So instead of folks making decisions on the behalf of community, really prioritizing community leadership and decision-making processes. And this could involve forming community advisory boards or co-leadership teams to guide an initiative from start to finish. And related to that is, in order to really do that equitably and to equitably work with communities in generating evidence and analyzing evidence and making sense of evidence together, we also need to really think about capacity building. So as a part of this collaborative process, we want to make sure that there's a focus on building the capacity of the community to continue gathering and using evidence independently. So this could include training in research methods, data interpretation, or advocacy skills, ensuring that the community has the tools to sustain the work. The process of gathering and disseminating community-rooted evidence should also focus on building the community's capacity to use that evidence for their own advocacy, political change, and future initiatives. So workshops, training sessions, and/or leadership development programs can be a part of this dissemination process to kind of further empower community moving forward. So again, these are just some initial recommendations. We have a lot more that are going to be coming up in a community-rooted evidence e-learning module that's going to be available on AMCHIP's website sometime in late January, early February, as well as a paper that AMCHIP is working on publishing with the findings of our qualitative research study. So if this is a topic of interest, there's definitely going to be more to come coming from this group early in the new year. But with that, I want to see if there are any questions in the chat that folks have that I could answer on anything that was shared here. And I'll pause for that. And then Noelle, if you also want to launch our evaluation for today's webinar, that'd be great too. But yeah, any questions? I know that this was a lot of content. It's a lot of kind of hard to grasp. It's very intuitive, I find, information, but it can be kind of hard to conceptualize. So I hope that that example helps to really make sense of what it looks like in practice. And yeah, any questions that you have, and if not, would love if you could fill out our evaluation.